Okay, good afternoon, everyone. Welcome back to session 3, or welcome to session 3 for some of you. The focus of this part of our budget scrutiny is health and adult social care. And we're very pleased to welcome Councillor Mary Aspinall, who's our Cabinet Lead. And it'll be great if your colleagues from the directorates will actually introduce themselves as well, because we can see names, but it'd be good to understand your roles as well, if for those of us who might be uncertain. Kamal?
I'll start there here. I haven't got a street microphone that I'll shout. I'm Tel, I'm a consultant in public health.
Thank you.
Thank you, Steve Mann, Director of Public Health again.
You must have liked the first session, you're back for more. And to Mary's left. Gary.
I'm not sure. So it's Gary Hawbridge, Strategic Director for Adults, Health and Communities, and including the DAS role.
Sorry about this. Emma Crowther, Strategic Director, Service Director for Integrated Commissioning. So that's all our children and adults commissioning for the council.
Thank you. We have budget information for your services for the city for the coming year. And that's a basis then for us to ask questions about the budget. But first we'll have a presentation from yourselves, and then we'll go through questions. So over to you, Mary.
Thank you very much, Chair, and thank you, Committee, for inviting me along. I'm going to split this introduction into two bits, obviously, because public health and adult social care are two bits of my portfolio. Within public health, the team works across 3 areas of public health. Health improvement, which is supporting people to live healthy lives. Health protection, which is protecting the public and the population against communicable diseases and environmental hazards. And the healthcare side of public health, which is the health service planning and delivery. This is underpinned by the public health intelligence function, which ensures that we can understand and meet the local needs. In 2024 to 25, Plymouth received 16.7 million, which was ring-fenced for public health grant, and it improves the health of the public and provides the following statutory function: sexual health services, NHS health check programme, health improvement services, which is smoking cessation, physical activity, healthy weight, etc. Drug and alcohol treatment services, children's public health programmes, health and work, that includes both of that, and public mental health services, National Childhood Measurement Programme, which is run by our schools as well. Health protection responses have to go through public health, and advice to NHS commissioners. We also received additional grants which have been received to support drug and alcohol treatment services, and we got 2.9 million during this year. And of course, our smoking cessation programmes, and we have had 0.41 million for that. The public health approach in Plymouth takes the population-based approach to promote well-being, prevent ill health and reduce health inequalities through impacting on the core determinants of health, which means addressing social, economic and environmental factors that impact on residents' health and well-being. This is achieved through our commission services and statutory function, as well as taking the systems leadership approach and within the integrated care system. Such leading on the Thrive programme really drives everything we do in that respect. And it doesn't have specific funding, but we all know that the Thrive programme has such great benefits for our residents. So then if I turn to adult social care, the net budget for 2024 to 25 is 103.394 million. And that includes 119.486 million of care package budget. Now, The astute amongst you will realise that doesn't quite add up, because it's then complemented by 46.694 million that comes from client income and from grant funding and savings targets. So far this year, Adult Social Care has supported 1,347 people in residential and nursing homes. That's made up of partially of older people, but there are also 233 of those at 18 to 64. There are 3,609 people who have been supported in community settings, and again, that is split 2/3 and 1/3 roughly between those under 64 and those over 64. And 722 people have been supported with direct payments. And that's when it switches, because you have far more younger people taking that up than older people. And if Councillor Lowry has his way, we'll get far more people onto that, because they are then in control of what they have and what they buy. Today in Plymouth, there are 3,731 individuals being supported by adult social care in both long-term and immediate care. Through our integrated arrangements, we have also worked closely with our NHS and systems partners with practical initiatives to avoid people needing to come into hospital, and of course for those that have needed to be in hospital, and supporting them to return home in a timely way. I'm really pleased that this year we've been seeing more people go directly home through the initiatives we have put in place. Through joint working across health and social care, we have been able to increase the portion of people who are discharged home rather to residential care by 150%. This is a significant success achieved through what remains a challenging winter period, and is testament to the focused work across our partners. And indeed, I had a meeting last week with the Chief Executive of the University Hospitals Plymouth, and he acknowledged the positive work that our teams were doing, so brilliant to them. I would like to give my thanks to all our health and social care workforce for the amazing work they've done this year. Working in health and social care is increasingly challenging and rewarding, so thank you to all of those. However, adult social care is a need and demand-led service, locally and national. We are seeing increases in need, complexity and demand. And I'm really pleased to say that we have been able to reflect this in our budget for 2025 to 26. The draft budget figures for adult social care is 112,607,607. Sorry, start again on that. Just over 112,000 million. So, anyway, whatever. So the growth includes 12 million that we bring to the care package budgets, and so that will be coming to over 130 million for the forthcoming year. The 12 million of growth includes 4.395 million for the impact of the national living wage increase, which, as we know, is going up from £11.44 to £12.21 per hour from April in April. And the remaining 7.7 million will cover the increasing demands in other inflationary pressures. As a local authority, Plymouth has a low council tax base, with most of our properties being in Band A and B. This means that we do not have that finance available to us within the precept. We know that the impact of deprivation means that proportionally more of our population live with ill health for longer, and that's in other areas that we will need to be supportive for them. The inclusion of the adult social care precept within council tax income isn't equitable for councils such as Plymouth that have these low council tax bases, and the level of deprivation that we have in Plymouth also colours all of that. This is why we welcome particularly the new recovery grant introduced by the government that's coming in this year. It's a positive step towards correcting these historical inequities. Now, from this, you've probably gathered that I've got a few asks of this committee. But one of the biggest ones I have at the moment is, can we see if we can ask government, particularly if we can look to the public health grant. Steve and the team there work really hard to make sure that our budget balance is there. But if we could know what we were having by the 31st of December each year, I'm sure that would help a great deal. Historically, we are often the end of January, and it's even gone up to May before we've had final settlements for that. So that would be something quite useful. But I'm sure you're going to have lots of questions, and I'm sure there'll be asks coming out from what you're saying. But as I say, we do what we can, and the team work tirelessly to make sure that we get things right. So thank you, committee, for listening to me. And I'm sorry I could never get my millions and thousands together, but I'm sure you've got it in your paperwork somewhere. Thank you.
Thank you very much, Councillor Aspinall. Are we going straight into questions now? Is that okay? Thank you. So raise your hand, please, if you have a question. And, okay. Councillor Blight to start off, please.
I note from the report that Devon ICB have taken over the work of the Dental Task Force. The budget report says this work is progressing well. Can you expand a little more on this, please?
I'm going to be cheeky and say they haven't actually taken it over. We've been pushing and pushing. We've managed to achieve some of the aims. If you notice, there were 3 aims that the Dental Task Force had here in Plymouth. And one of them has been really successful in that we've been able to make sure that the social dental enterprise is able to take over a premise in the city centre, and they will be kitting that out for a teaching establishment, but there will be treatments offered there. It's an extension to what they offer at their normal places at Devonport and up at by the hospital, so that's really good. And although in theory we are making progress, one of those things that we really need to try and make progress on is the contract. They are putting in golden handshakes for dentists, but it's actually, we need to be making sure that the budget that the government set and the payments, etc., match what needs to be done to make sure that people find it as attractive to work as an NHS dentist as it does in private practice. And so that's going to be one of those things that I will really, really be pushing on, because that is an essential part of that three-leg stool to get that. But we are making progress, but it is slow, because as you know, that the dental waiting lists are so long in Plymouth for treatment, and one of those things that the ICB need to do is to look at those lists and make sure that the right people are on it, and that, or there haven't been people on it for so long that they've finally given up and gone to a private dentist and are happy with that. But it's, to me at the moment, the contracts are the thing. But I've got to welcome the fact that we've been managed to, some of the clawback money, that how we've been able to use that, and there are good services beginning to be established. But we've got to get more NHS dentists. No two ways about it.
Thank you. Councillor Murphy, please.
I get you, I know, little body, and I. Mary, can you give us an update on how the replacement for Colwell Lodge and the Fines is progressing, please?
It's really exciting that it's going to be a fabulous place when it's built, and I'm going to hand to Gary now because he's got the more up-to-date figures on it, because as you'll know from the capital spend, this year's 25-26 is going to do the major part of the capital spend, but Gary will have more of an update. Thank you.
Yeah, thank you. Councillor, so at the moment, they are out to tender for what's called the final design build. So that process is happening now. That concludes in February. And then the intentions are that by the end of the financial year, they would have let the contract for the build, which will then take just over 12 months to complete. So we would be looking at trying to get into a new building for all of those people in about May or June next year, 26. So it's quite exciting when it comes. These things are long in the planning, slow in the delivery, but really impactful when they arrive. So we're looking forward to it.
Emma, do you want to add?
I was just going to add, I was out at the Life Centre yesterday meeting the chief exec there, and he was saying what fruitful conversations he's having with the project team for that project about how they can work together across the two sites to really make the most opportunities for people who are using the new build to come across and experience the facilities at the Life Centre and vice versa, really create that sense of community there. So that felt really exciting.
Everything okay? Councillor Freeman, please.
Good afternoon, everyone. I have a question. I think it's probably more orientated towards our health colleagues who are here. The reading through some of the various reports that are around, some of the wards within Plymouth have some of the lowest scoring on the health indices. So, for example, the gap in life expectancy between the lowest and the highest in Plymouth is 8.2 years. That was as of a 2019-21 report. According to a 2022 report, 2 areas fall within the most deprived 1% in England, and 28 fall within the most deprived 10% in Plymouth, affecting some 46,000 people within the city. So with that bit of information, what I'd like to know, please, is what provision is there within the budget that is going to help to increase and better these inequalities, please? Thank you.
This is a great introductory question for me, isn't it? 6 weeks in. Okay, let's give it a go. So the public health budget that we get, as Councillor Aspinall said, is 16.7 million. And I would like to say that all of that money is designed to improve and protect the health of the population, tackle inequality, and address life expectancy. You've highlighted perfectly that we have disparities across our city. I think the Fairness Commission as back as 2012 said that Plymouth is a tale of two cities. If you live in the west, you're not going to do as well as if you live in the east of the city, and we need to balance that. Life expectancy is important, and Plymouth fares relatively well in regard to the nation, but actually life expectancy is kind of becoming a bit stagnant. We saw that kind of pausing of it through COVID, and we haven't really recovered yet. What we also need to think about is the difference between life expectancy, so how long you live, and healthy life expectancy, because that's a real challenge that we see in the city as well. So if you're a female living in Plymouth, you are likely to live a long life, but you're probably going to live at least a decade in poor health. So that's what we're looking to address. As Councillor Aspinall's touched on, the Thrive programme is really fundamental to helping drive this agenda forward. We've been very fortunate to celebrate 10 years last year to reflect on the good work that we've done, recognising that some of the core lifestyle modifications has an impact on both life expectancy and healthy life expectancy. And now we've launched the vision for the next 10 years, which is very much going into that space. So a lot of the funding that we have addresses some of those real core challenges. So some of our statutory functions, including addressing health and well-being in children, for example, and trying to encourage a longer, happy, healthier new generation, but also focusing in that ageing population space as well, because we recognise that Plymouth is generally an older population that is continuing to get older across the next 10, 15 years. There's a number of programs that we have in place that we touched on in the previous session, actually, around that community enablement space, which is how we as a public health team, but also as a council, work with our core partners and communities to make sure that we put health and well-being at the centre of those communities. So it isn't necessarily about me giving money to the community, it's about helping the communities to understand what their health and well-being is like and what we need to address it. The challenge with both healthy life expectancy and life expectancy is it doesn't change overnight. So whatever intervention or resource we put into that space, you generally don't start to see that change in dial for 5 to 10 years. It doesn't mean we shouldn't be doing anything, and it does mean that we continue to monitor that data. But as I said, COVID kind of scuppered some of our plans around the staggering of that life expectancy space. As I've mentioned, women's health is really important, and we recognise that there's a disparity in women's health across the whole city, but would be more entrenched in those more deprived communities. So there's a real focus for the Public Health Department this year under the Thrive umbrella to really look to try and address that for the city as well.
Can I follow up with a question on that? Whilst I fully understand you saying people are living longer but sicker sooner, where's the tipping point when people start, for example, they grow up, they go to school and so on. If we're talking about women, I'm not being too generalistic here, and if they have families, their kind of life pattern might change. So what happens next to enable people perhaps to continue or pick up healthier living habits? So where does it start to set in the problem? Because you're dealing with the outcome rather than where does it start to slip?
Yeah, so actually public health is beyond the outcome. So it's, again, like we talked about in the session before lunch, is that we're going away from a kind of a crisis management into a prevention space. So public health ethos is very much around how do we get people into that prevention space. When people start to become ill is based on a whole variety of factors, but if you are in a less deprived area, you're more likely to be healthier for longer. And things like age and metabolism in your less deprived communities are always going to have an impact. So I think we all realise that once you hit 30, we all start to get that middle-age spread a little bit. But the whole nation is getting bigger. But when you look at our deprived communities, it's really kind of before you're even conceived. So it is very much around that focus on early start, because if we don't have healthy pregnancies, we then don't have healthy babies, healthy children, healthy families. So it is about intervening or supporting throughout the entire life course, because we know that we won't have healthy families if we don't get children ready for school. In regard to making sure they're vaccinated, that they're at the right stage of development, that they engage with school, so they get a good education that leads to good employment, and then happy, healthy families as an outcome of that. So it's different for everyone because everybody's lifestyle factors are slightly different and their outcomes are, but that's where the focus around that prevention space is really key. So yes, a lot of the public health intervention is firefighting some of the challenges we see in regard to obesity and the consequences in relation to diabetes and cardiovascular disease. But actually a lot of the public health work is very much trying to ensure that we create a new generation of happy, healthy families that will live long lives, but happy, healthy, long, independent lives that require very little intervention from either local authority services or other partners across the city.
Can I be obliged? Go on, Gary.
I'm going to ask Gary to come in because there's obviously a lot of bits and pieces that adult social care do that help support that as well.
So I just wanted to build on that point, because it is an entire continuum, isn't it, around prevention. And then for those people living today who perhaps aren't living in that way Steve will describe, we're at that place where other services, adult social care and others, will try to take those steps with what we call early intervention. So recognise that some people may be not in the place that we would hope, but are there where if we spot and can act early, we can also help move that point in life for them, but also help prevent, delay the need to access statutory services as well. And I think that's a key pillar of a lot of services, adults included, in terms of the work we want to do, is make sure that we are in that early intervention space as well as prevention, which is that longer term. piece.
Can I pick up on something that both Anne and Emma mentioned earlier on? Where we've got the Life Centre and the Outlet Road development tied in as a partnership, with an area such as Devonport, which is a deprived area, or one of the highest levels of deprivation, will the new Brickfields development be used as a catalyst for more, and it's not just individual adults, but family engagement there, and it's actually physical and mental health and emotional health.
Technically, this is Sue's, Councillor Dan's portfolio, but I'm sure Steve will be able to give you some answers.
Itching to answer the question as well. Thank you, Councillor. So yes, the actual provision of the sites does fall under Councillor Dan, but I think it's really important to just separate for a moment the difference between the delivery of leisure services and the utilisation of these spaces for that broader health and wellbeing agenda. So yes, Folkestone Park and the broader Brickfields health and wellbeing hub work is already underway, and we are already building on work that's being done in that space. So it is a priority place. We want people to be physically active, and we want people to have good health and well-being, whatever that means to them. It doesn't necessarily mean that people have to engage in sport. It's about looking at utilising those assets, and the great thing about those assets is that it does allow families to engage in a different way within their localities in an area that previously hasn't necessarily seen that investment. So yes, we very much saw the opportunity to develop health and wellbeing hub in that space to complement the other 9+ that we've got around the city at the moment, as a priority going forward as well.
Okay, Councillor Nay, please.
Thank you, Chair. I've got a couple of questions for our public health gentleman, if that's okay. So the first thing I'd like to know is, in the last 12 months, have we improved and increased our number of dentists in the Plymouth postcodes?
So I think I can't answer that question, unfortunately, because the NHS is responsible for commissioning of dental services. So it's not a question that I can answer. I think what I will say to kind of provide some assurance is we are looking at how we utilise some of that dental funding with the Integrated Care Board to try and maximise the amount of oral health promotion we do to try and reduce the strain on capacity. As Councillor Aspinall's highlighted, it's a national crisis in regard to dentistry, but it could be a question we could take away and get a further answer to for you.
Councillor Nate, I'll get that. We've got a dental task force meeting on the 7th of February, so I'll ask them to provide me with the latest figures on that.
Thank you, Councillor Aspinall. The other question I would like to say is, with regards, you know, tackling inequalities in health, it's a government-led programme, isn't it? And we've talked about improving people's health at all ages, cradle to grave. You're never too old to improve your health, you know, stop smoking, improve your diet. But actually mentioning Brickfields and the leisure centre, then is there anything that's free that people can access to improve their fitness and health in the city?
We've got a huge programme of things that we commission, etc. I think rather than me trying to make a stab at that, if you want to give a couple of the examples that we've got, but there is stuff that's free. I mean, it's like stopping smoking is free, as we all know, and the vaping, you know, we've done a lot of work with vaping as well. So I'm sure Steve will have some further update.
So that's, I think, where the health and wellbeing hubs come in, because what they do is they highlight, they work with individuals, particularly in that social prescribing space, to be able to highlight some of the free access to services. So this is, again, it's not necessarily what the council provides, it's about the connectivity we can have with partners out there in the broader city space. If you take somewhere like the Life Centre, for example, it does deliver a variety of programmes associated with some long-term conditions that residents can be socially prescribed into through primary care or other sources, so they can access that without requiring membership. But there's a whole range of activities across Plymouth, and we're just trying to create that connectivity, so whatever people want to do to be physically active, they are able to do, depending on their ability and their, you know, what they want to do in their space.
Thank you, Chair.
And yeah, so absolutely, it's about building that capacity within all the communities, which is one of the things we ask our health improvement service to do. So they do training on kind of lead walk-in, for example, but particularly in physical activity. But when someone refers themselves to One New Plymouth for kind of lifestyle support, be that smoking, weight, exercise, the service will work with them to understand what's important for them and what goals they have in order to improve their own health. So that might be physical activity, and they'll support them in that way, or that might be smoking, or that might be weight. And the important thing about that service in terms of inequalities is that we really work with them to make sure that a high proportion of people who use that service are from our most deprived wards. That's one of the kind of key things that we I say KPI, we manage in terms of KPIs of that service. So I think it's in order to kind of address that inequality.
Thank you. Councillor Ricketts, please.
Thank you, Chair. Just wanted to get a flavour of the kind of recruitment position in adult social care. Obviously, there's been a lot of, it's been a big issue talking about just generally young people or anyone wanting to get into adult social care and into the care sector. How's that reflected in Plymouth, and how are we filling the gaps?
We have our own organisation called Caring Plymouth, which is one of those really wonderful organisations that people can go and get advice. They can be directed. There's every Monday, I think, they're over at the upstairs floor on Barclays Bank over there on Armada Way, so that they're giving advice. So it's a very proactive organisation. Emma, do you want to update again?
Yeah, absolutely. So we launched Caring Plymouth in November 2023, and it's a partnership across us as the council, University Hospitals Plymouth, the ICB and Livewell, and all our education partners in the city, so our sort of skills partners as well. It's really phenomenal. They do two main strands of work, really. One is around the sort of pipeline into adult social care. So they will go to schools and have those conversations. Certainly no one ever suggested to me a career in adult social care when I was a child. So we're trying to change that, get into people's thinking as young as possible. And then there's a retention piece. So there's a skills directory, a training directory for workers in the city, so they can see their career in adult social care as a career that they can progress through, become managers if they want to. That's really positive. We offer direct support. So if we know that an employer in the city, an adult social care employer, is struggling, so it might be a care home, say, we will send a worker in to come and have conversations with those staff to show them where other opportunities are. So there's an awful lot of work. So the retention piece is really important. The pipeline piece is really important. But we're also trying to think further ahead. We know we're going to have an ageing population. We know we're going to need more workers in adult social care who want to come and want to stay. So there's a lot of work going on at the minute around the data and projecting ahead. We've got a really strong profile now of the people who work in adult social care. Quite a high proportion of women, quite a high proportion of women who are in their late 40s, for example. So again, we need to think about that. How are we encouraging more people in younger to come and stay and really stay with us? We also know a high proportion of adult social care staff, if they leave, they go to the hospital. So again, we're in conversations with Derriford about how do we manage that between us, and just sort of manage that safely and encourage people to remain with us, really, but also stay within the sector. So there's a lot of work going on, really positive. And in terms of retention in adult social care, it's pretty good, isn't it? As in Livewell.
Yeah, our social work retention is really quite good, and actually probably the envy of quite a few other areas. And I think I would just add, this, if we remember coming out of the pandemic, where social care workforce was a real huge issue nationally, the work Plymouth has done, it's been something that across the region and other places there's a lot of interest in, because we've done an incredible job at stabilising the ground we're on, but we now need to move forward for the rest of it, and it will be an important part of the work we do this year, and solving it together.
Yes.
So our health colleagues, Department of Work and Pensions, all the different care organisations, universities and trades, we bring all of those people together to try and solve that problem. Whatever career you want in health and care, there are fantastic careers. We'll help you get onto that platform and find the job that works for you. And I think that's the tactic and that's the approach we've taken, which so far is proving to be a very positive one.
It's proven to be a really honest, open conversation. So everyone is sharing their data now and sharing their challenges. And it means that it's entirely, if you want to have a career that hops between health and social care, we'll support you with that. So it is, like Gary said, it's a very collaborative approach. It's not we lose you there and we gain you here. We do it as a system.
At the launch, we had a booklet of all the training, etc., that's available. I'm sure in a cupboard somewhere there must be a few more copies from it. So, Chair, I'll see if we can find them, and then we can distribute them to the committee so that they can have a look and see what's there.
Supplementary on that, Chair. Sorry. So I'm not an expert on this subject, so it's just, is it still, what's the government's position on this still? Because there was a points-based system, wasn't there, for overseas work permits to get people into the sector. Where are we with that? Is that changed or is it the same?
So the arrangements for international recruits to come in to work directly in social care have changed, and we don't see new people, but there is a cohort of people in the country, and the focus is around how we maintain and keep those people involved in care.
Is it changed then?
Yeah, so it's stopped. So we don't bring the international
6
recruitment
months ago?
program, particularly for social care. It's different for healthcare and all of those other, but inside of social care, so the arrangements stop. So there aren't new people coming into the country yet.
Thank you. Can I just add the billboard advertisements around the city? I don't know if that's a citywide or regional or national one, but they really aim to make care work attractive and as a career. So I don't know if there's any measure of impact on that. When you get new people joining your workforce, do you ever find out how they got to where they are?
Absolutely. So we monitor that. We monitor the number of vacancies in the city. We track who's coming in. We know that there are people who were long-term unemployed who have been supported into careers in care, and we know the outcomes for them. We know there are people who have come in absolutely brand new. So the Care in Plymouth team do a lot of work around understanding the routes in and what makes people stay, and equally what makes people want to go as well. There's an awful lot of work around understanding what makes it really hard to have a career in care. But we would say it's the best sector to work in. So,
Back of a bus adverts work really well, isn't it? Yeah. Councillor Darcy, please.
Thank you, Chair. Thank you very much. Mary, if I may just point this in your direction, but it'd be interesting to hear from the officers who support you. As we're, bless you. Any more? As we're here to focus on the budget before us, I'd be interested, and I probably challenge this every year, what's keeping you awake most? I appreciate all your portfolios keeping you awake, but what is it that's keeping you awake most that you think is going to provide or present the largest or the most significant risk to you looking ahead in the financial year? And I guess in a second or supplementary part to that, Mark's not here today. Mark Lowry's not here today. So let's assume Mark's not going to even watch this. If you had a magic wand and you got release Mark's hands off the purse strings, are you content that the budget's sufficient, or is there something else that you would like to see added to the budget that Councillor Lowry's not here to defend, so we can authorise that? But what's keeping you awake, Mary? Where do you see the opportunity to deal with that risk, or are you content that the budget's sufficient? And be interested to get your thoughts on that. We've heard some great stories Emma's just shared about staff retention, which is really good. That's always been a real issue for us as a local authority and not exclusive to us. But what's keeping you awake and where are the opportunities to address that? I'd be interested in hearing that, Mary, with the budget in mind.
I think every cabinet member has their own particular things that they worry about. And I've got to say that the worries that I have is, are we meeting the needs of that person out there? You'll all hear me refer to Mrs. Miggins or Mr. Miggins or whatever. You know, are we making sure that their needs are being met? And if not, why not? And I think that to me is my biggest worry. And I think also, are we making sure that the checks that need to be done, the assessments that need to be done, are they being done in a timely manner so that if somebody has a need for disabled facilities grant, for instance, which I'm really pleased the government have given us a rise this year, but are we being able to meet that so that they can stay in their homes safely and that their families aren't so worried? So it's that bit, to me personally, it is what really concerns me, and the team will know that I quite often nag about some of the waiting lists, particularly for occupational therapy and for making sure that social workers are doing those checks that need to be done on people in a timely manner. Those are the real things that bother me. So it's difficult because we often have to rely on NHS monies coming in to make sure we have to we rely very much on Live Well as our partner in sort of delivering some of these services. So it's making sure that all these things slot together. And yes, some extra finance would help some of those things, but it's also making sure that our partners are putting the right finances in as well. So it's, are we getting those monies from the NHS that we should have, and again in a timely manner so that we can improve the outcomes for people, because that's what's important to me, it's those outcomes. And if we think about safeguarding adults, that's part of the thing that I oversee as well, is making sure that we don't end up with tragic cases that if things had been handled slightly differently, and it's always a learning exercise when you look at safeguarding reviews, always a learning exercise, that we are keeping people safe, and that's what it's about to me. It's keeping people safe. We are fortunate that we have such a big community family within Plymouth that you'll usually find somebody knows Mrs. Miggins down the road who isn't particularly managing, she's not being able to go out to get her shopping or whatever. And it's all those community networks that we have in there that I'm now really, really pleased with the amount of community hubs we've got going, that somebody can just be going for a cup of coffee and say, oh, by the way, I'm a bit concerned. So again, we know that somebody can phone into the council phone number and pass that information on. So it's all this joining things up. And I think the other thing that I'm really looking forward to is how's AI going to assist in what the next few years bring to how we manage social care. So there's a lot of things, but I think the most important thing to me is, are people safe in Plymouth? And that's what keeps me awake. And it's really good from a cabinet member to know that I trust this team, and I know if they've got a hiccup, they will come, and include Helen in that from the finance side of it. You know, they'll come and tell me if there's something going wrong or that we need to look at something. And it's that trust that you build up. I'm basically a no surprises person. I'd rather be told than to see something flashed in the national news or local news or something, and I think, oh, I didn't know about that, because that's, I'm sorry, I need to know, and the team here are great, they make sure I know.
Can I, and I guess you've alluded now about the focus on prevention, but also there's demand as well. So whilst it's welcome there's additional money, it's that pivotal bit, isn't it? How much do we put towards prevention at the expense of demand? What's the answer?
And that's where the commissioning side of it comes into focus, and Emma and the team, along with Gary as well, is checking that we've got that balance right. So I'll hand.
Thank you. To pick up on your point, because I think you're right, and it answers, really, this is part of me answering your question as well, Councillor Darcy. So I think from my perspective, if you look at the health and social care system now, post-pandemic, there have been a number of changes. So in terms of what might keep me up at night, it would be how do we used to really strongly understand all of that demand that was coming through our services. That profile has changed, so we're having to learn more about that different profile of demand that comes. And that's a challenge for us. It's something we do, but I think the profile of need in our city changed at that point quite profoundly. But then to link that to the magic wand and the prevention thing, I think what for me it would be do more in that space more aggressively and get really, because we know you can't continue to turn the handle of what you do today. You've got to move differently. To bring that into the budget questions, you'll see in our savings plans, our target operating model, some of that is us putting our feet on that road. So if there was more money, we'd start to run on that road much faster. And I think because the investment in prevention, you've got to go at a pace that's sustainable. And I think that's the thing that's important. The other thing I would do is I would then want to make sure that health money kept pace with that change of need and demand for our local population. And I think that would be the other part for me.
And in the Market Sustainability Improvement Fund, that's mentioned on page 17, it said that 5.6+ million pound has been allocated. It's the same figure as last year, with no inflationary increase. What challenges does that present for you? Or have you worked within that available budget?
So we know we're in regular conversations with our commissioned care providers through our various forums and other means, and we know that they are worried about the cost of providing care in terms of the same pressures that we all have in terms of heating our homes, lighting our homes, etc. But also in terms of, we were just talking about workforce retention. It's hard to retain people who feel they're not valued enough financially. So we know that that puts extra pressures on as well, and that is a challenge. So we really do need those grants to keep pace with those pressures, because what we know is the cost of providing care is not staying the same. And as Gary alluded to, we are seeing more people coming through with more complex needs, so they need more of a range of supports than they did previously. So we really do need those sorts of bits of income to keep pace with the costs.
And just to add to some of that, so that grant has stayed the same. Some have moved. What we also get, of course, is impact around national living wage and all of those other things that create pressures for us. What that means is we have had more money and we have had growth money. Some of it has to go to cover off those core costs. The rest then goes into growth. So clearly, if there was more grant, there'd be more money for the growth, for the pace of the prevention and all of those other bits of work. We do that at more pace. And I think that, for me, is the balance that everybody strikes, not just adults, around the investment and the pace of change and the ambitions that you've got. So I think that's there. But we have, thankfully, had growth money. It's just that what we also have is some of the costs given to us, which eat into that.
Which is better than not having the growth money, or else we would have been worse off.
And the consequences there are then you have to look really hard at what you do, and you have to start to compromise some things that you wouldn't want to do ideally.
Okay, I have another question if I'm allowed. Well, I am allowed myself one.
You are the chair.
Yeah, so, no, if they're, I'm just checking they don't want to jump in to ask a question. Can I go into in the paperwork we have the savings bit, and just want to know, the reason why certain saving decisions were made. For example, in the banding health contributions review, there's page 32. And correct me if I've got this wrong, that it's not a savings and an income. If it is, I'll stop my question. Where it looks if it's £500,000, is that a saving in that section?
So that's us. And actually, there are a couple of aspects for this for us. We know we buy residential and nursing care ideally and hopefully at some fixed fees. We also have some flexible fee rates that we can use. When we came through and when the pressures have been so high around discharges and all of those other areas, particularly coming out of the pandemic, we had to put in place different arrangements to support people when those things were at their height. That there are some people where we bought off the banded rates. And so there's some work there. We know that if we do, we'll see some change in our budgets and our benefit, and we estimate that around £500,000. There are also other conversations around some of the investment with the NHS and how that's made in terms of helping to cover off some of those costs that we do in partnership, which we do every day. So what we've done is put a figure on what we think that will look like for this year. We know it happens every year, so we know these things happen. So it's not as if we're we're taking a high risk fund. We know it will happen. We've then estimated that benefit.
And family hubs, just over £250,000 was cut out of that. What impact might that have on the work of those hubs?
So we work really closely with the family hub providers. The 3 providers in the city have done for many years to discuss that with them and mitigate. Often it's around, we try not to let that impact on direct delivery for families as best we can. So it might be about holding some vacancies, it might be about other adjustments. We have benefited from Start for Life grant funding for the last couple of years. We are hopeful that that will extend for another year at least. We use that to help enhance the delivery offer in the city. We are seeing that with some of our services where the reliance on grant funding is becoming more of the core budget. That's if you ask me what keeps me up at night, that's one of the things that I worry about, that the amount we have that's solid in terms of funding is now less in some instances, some services, than the grant funding that we have. But we do try to make sure that that grant funding goes directly to delivery. But it's about the conversations. There are no easy conversations with any of these savings, and it's about open and honest discussions with the providers about how do we manage this together? Is there things we can help with? Is there things they can do differently? Do we have to adjust what we can expect them to do? And we just manage that risk between us as best we can.
And my last one to ask about that is the Disabled Facilities Fund and to Community Connections. It seems as if it's a big drop from £3 million this year to 0.366, page 39. Have I read that correctly?
It's capital.
In capital. Don't worry about it. You let off. I've got one.
Ask him one about sport.
Yeah. Yeah. And a final one from me is Live Well. Obviously, we have a contract with them. How do you hold them to account for the services and the value for money and the value for service on people that they're expected to deliver?
There are regularly meetings between us all, and certainly from the figures that come out for the number of clients they've seen, etc., I see. But on the management side of it, that's Gary and Emma and the team look through that. So Gary, do you want to comment on that? We are very, I'm not saying strict, but we do make sure that we're getting answers. So I think please be reassured on that, but that doesn't mean to say that we're content. Yeah. We will keep pushing where we see that improvement is needed, certainly. Gary.
Yeah, so just to work through, so that arrangement is set up in a formal contractual way. So we have those kind of levers and mechanisms, but the way we approach that work with such a key partner is we have a set of governance arrangements in place, so there are regular, so each and every month, probably each and every week we meet, but there are formal settings each month for what's happening around performance, what's happening around practice, what's happening around money, and those things drive it. We've recently been bringing Live Well more formally into Scrutiny, so that we can also make sure that the arrangements are exercised quite rightly in that regard. So we have quite a robust set of mechanisms in place that are there with Live Well. It's really important, isn't it? Because it is still the council's responsibility to deliver adult social care, and whatever we do in a contract, it doesn't change that fact. My job as Director of Adult Social Services is to be accountable for that delivery, so we exercise that through that governance set of arrangements. And we celebrate all that good performance and outcome for people, but we also talk about what, for example, as Mary brought up, trying to improve waiting times for people and all of those other things so that we get the best value out of this, but actually so that people benefit the most from the services that we're there to provide them.
And finally, given that the extra money's come in, and it'd be really helpful to have some sort of feedback on how that additional money has been used and what impact it's had in adult social care, because it's obviously been a pressure for Plymouth City, it's a pressure for every local authority in the land, and it probably will be going on for a while. And whilst extra money is really welcome, as opposed to most years previously when it's been really a struggle or a cut, it'd be really good to know, okay, this is the difference it's made. or it'll make no sense in us ever asking for more money, just to show the value added that extra money can make. And I guess that's to core services rather than just enhanced, because it's a case of providing the basics as best we can.
And this is the report we take to the Health and Adult Social Care Scrutiny Panel, along with performance. They regularly have performance charts from us, but certainly if the chair wishes to have other certain facts, we would be very, very happy to share that.
And it'll hit waiting lists positively, do you reckon? Some of the money?
It better. That's all I can say. We're really making. We regularly invite Live Well to come to the meetings so that the scrutiny panel can challenge them as well. So I would be expecting us to come and see those improvements. Definitely, there's quite a feisty chair of that committee, you know.
So recommendation perhaps is to make sure that that effectiveness of the additional money is having an impact on the provision in the city of next year. Okay. Right, 3 down, 2 to go. I think, but I want to thank you all for.
Yeah, can I just come back and just sort of say what I'd really, really like you to be doing is to make sure that we're able to keep challenging our partners to be delivering best they can. And I think what I really, really want to see is that equity of funding that comes through the NHS, making sure that it does what it should be doing and in a timely manner. That's the other thing, because sometimes, it takes a little while. But I hope you feel that you can endorse this budget or draft budget as it is still at the moment as a safe budget. But please be aware that we will be making sure that if there are any further grants, funding or whatever available, we will be chasing them very vociferously. And the same within public health. The team there make sure that they spend every penny appropriately and that we get good value for money. But it's always useful when extra funding comes in for specific things, which it will do because of the vaping bill that will be going through Parliament. There'll be funding attached to that. So this next few months is going to be really quite exciting, really, in that things will be changing. Whoever thought we'd have young people that were never allowed to buy cigarettes because of their age? 5 years ago, we wouldn't have thought that would happen. Those of us that have been on this council for quite a while know the varying scrutinies we've done on smoking. Ross is nodding his head, and things like that. It's good to see things that are coming together, which are good public health decisions. So, thank you.
No doubt, whilst it's not our responsibility, no doubt you're all rejoicing about the news about the emergency department. Obviously the CDC kicking off in the next couple of years.
And that's brilliant that they've got that funding. And also, I know that Gary is working with Stuart Windsor and the team that are dealing with the CDC down in the Colin Campbell car park down there. And it's been good that we've been able to provide the land, and then obviously the NHS do the building, and the influence that Gary and the team will have on what's going into that will be really welcome. And of course, if we can expand it and make a health and wellbeing hub down there, that all the better. If we can get further buildings, so
in your areas of deprivation as well,
we need to keep pushing on that. But some brilliant things that are coming out, and certainly that reassurance that the hospital have got that money was wonderful yesterday. I think a big cheer went up all over, and congratulations to Mark Hackett and Stuart Windsor, and let's be honest, to our MP for getting that push through. So well done to all of them.
For providing us the answers, providing us the information and the service throughout the year. And some of you will see each other at the scrutiny panel for health, adult social care next. Okay, thank you. Sleep well tonight.